All right. Thank you for joining me in discussing what I would do with my patients in crisis management. First patient, 45-year-old male, married for 15 years, two children. Who had some history of major depressive disorder since his 20s. He's also had some issues with pornography that he's been getting help for, and he's been working on it. And he said it caused some strain in his marriage, but he thought that his marriage was going okay. But then come home and find out that his wife has left a note and have taken the two children. He said the kids are his life. She told him that she had been cheating on him for 2 years. He had no idea. It really stressed him out, was actually having him making him have sort of a breakdown. He said he didn't know why he bothered improving himself if his wife was going to cheat on him. So he was prompted to know about if he had any suicidal or homicidal ideations. And he said he's been drinking a six-pack a night and he has plans to shoot himself. He, and when he was asked what was keeping him from actually shooting himself, and he said that he does have some hope of seeing his kids and being with them, but he's losing hope that he'll ever talk to them again. So one of the bigger things that need to be done with this gentleman is he actually needs to be screened. We do know he has a history of depression, but where I work, we do a PHQ-9 yearly. And we could actually do the PHQ-9 to see where he's sitting at on the scale about his depression and addressing his suicidal ideation. If he scores pretty high on that, then we can actually go ahead and do the Columbia Suicide Severity Rating Scale, since he did tell us that he would go ahead and shoot himself with a gun. And we will see what his plan, his intent, and we do know he has an ideation because he's expressed it. But there is also another tool that can be used. It takes about 20 seconds. It is for patients 8 years and older. Just simple yes and no answers. In this tool, the Ask Suicide Screening Question tool actually have some safety guides, some worksheets, strips, flyers, pathways that you can take to help take care of these patients. But if he was first of all, I want to know if he actually has a gun. Is it in a locked box? Is it in the car right now? Is it fully loaded? I mean, I've had an incident before I was an emergency room nurse, and I had a patient that told me that he would shoot himself in the head. And I actually found out that he had a loaded gun in the car that he had been driving around with all day. So with that incident, being in the ED, we called the police because the gun was not in our building. We called the police, the mother came, they were able to get the gun out of the car. The police was able to take the bullets out of the gun and give the gun to the mother. So that's what happened with that incident. But with him, I really want to know where the gun is. Can he get to it if I was to let him go home? If I was to let him go home, then he would actually need a safety plan that he and I would both agree that would be feasible. And it would be easy in lay terms for him, a plan that he can go to and go back and revert to. Again, him saying the gun, him telling me that he's hopeless is a big concern for me. If I felt that he couldn't adhere to that safety plan, I would get we call in my area the community service board to come in and do a true evaluation of him to see if he needs to have a temporary detention order, a TDO. And of course, the TDO lasts for 72 hours. So whatever facility that they are admitted to, they would not be allowed to leave for 72 hours before they saw the judge to deem that they were actually safe to go home and that they were not going to be a harm to themselves or anyone else. That's my big concern with him. He's been on Celexa and the 20 milligrams have been working, but his depression apparently is worse. So we need to go back and reevaluate his medications. He needs some therapy. He needs some resources. So being in the facility inpatient is a great benefit for him. He would get assigned a case manager to give him resources in the community, get him set up for his outside appointment. psychotherapy while he's in there. His medication could be adjusted, but we do know that antidepressants, they don't take immediate effect. But he could use some dosage adjustment, possibly. The psychotherapy, group therapy, could he get family involved outside of his wife and his children? Is it someone else there that can help him? We will really need to connect him with some great resources to make sure that he gets what he needs. Can we do something to help him with his drinking, since he's increased to where he's drinking a lot of alcohol every night? That would help induce him actually having suicidal ideation. So how do we help him stop that? Those things are important to prevent him from actually going through with the suicide. Who, again, the gun is my greatest concern, and him being on the medication and getting the help that he needs. The second case involves a 19-year-old married female. She has a 2-month-old baby. Her husband is present with her. This is her fourth visit. She's more provocative, has on more makeup. She's more all over the place, loud, rapid speech. She's looking at a lot of alien videos, and she's decided that if she offers her baby up to the aliens, then she could save the world. So with her, she definitely needs to be screened for bipolar disorder. We need to do an extensive physical exam. If she hasn't had a thorough psychiatric assessment, then we definitely need to do that. We need to look at her background, any trauma, how was her upbringing? Does she have any family members with any other psychiatric disorders? There's a possibility that we could do some mood charting. We'll look at the criteria for bipolar disorder to make sure that she's fit in the bill. Treatment would include her taking medications, the importance of her knowing that she needs to adhere to the medication. But with her being in that state of mind, loose associations, she may not really get that. So she may really well be a candidate if she won't volunteer to go into for treatment, that she may actually need to be hospitalized also. And then that may take that she actually gets a TDO, especially if she doesn't believe that anything's wrong with her. So taking her medication is really, really important. Is there any substance abuse? Is there anything else that might be contributing to her behaviors? So as far as the mood stabilizers, if we're going to put her on anything, we're talking about lithium, Depakote, valproic acid, Tegretol, and Lamictal, and there's some other mood stabilizers. But we will still need to take consideration her whole being, her total self. Is she breastfeeding? What else is going on with her? And if she needs to be on any antipsychotics, we can do Risperdal, Zyprexa, Seroquel, Abilify. We will find a medication that fits the bill for her. One of the important things we will need to explain to her and her spouse about, the side effects of the medications, and that with lithium and Depakote, we need to be careful to make sure that we don't have any EPS symptoms, and she may actually need to be put on Cogentin. Is she pregnant? We will get lab tests, UDS, pregnancy tests to make sure she's not pregnant again. Is she on birth control? So all of these things will need to be taken in consideration if we're going to put her on medication. The other thing, she will definitely need psychotherapy. She needs follow-up care if she is hospitalized, so that she can learn more about her disease process, things she needs to take care of herself and her baby and her husband, if she wants to be a productive citizen with this particular mental health disorder. Cognitive behavior therapy, things to teach her how to cope with this, things that she will look out for. That's very important for her. Her spouse, he will need to probably do some family sessions, and he may actually need to do some therapy on on his own, so that he could better understand his wife and what she may possibly go through, and then like coping things for him. How does he help her? Um, that is very important because she's very young and she's a new mother and she's a wife. So those things in itself can be very stressful. So those are the things that I know that I could help these two patients with. Thank you for listening to me.